Has anyone ever told you that your teen's FND is all in her head or psychological or that they're faking it? And as a parent, I know how frustrating, isolating that can feel. But here's the truth. FND is real and it's not all in their head. In this video, I'm going to explain what FND really is and why your teen's symptoms are happening and fluctuating, and then how you can actually help them heal. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of online group coaching program Teen FND Academy. So today's video is kind of back to basic. What is FND? Okay. FND really stands for functional neurological disorder. And it used to be called conversion disorder, hysteria, whatever other kind of crazy names. However, it is essentially the brain and the body miscommunication network problem, even though your child's brain and body are physiologically and structurally okay. Obviously, it is a real condition and an oddly very common diagnosis you would get in neurology clinic, even though you probably didn't even know what it was or know anyone else who has this condition, right? And FND symptoms are really coming from a place of biopsychosocial phenomenon. And there are some things that were predisposing, what was kind of cooking in the oven previously, and then what triggered, precipitating factor, and then what is keeping the fire of FND alive, perpetuating factor. I would call it 3 Ps: predisposing, precipitating, and perpetuating factors, and the biopsychosocial model. So because of all of these things, moving parts, FND is not in their head. It really means the brain is stuck in this survival mode for however long. So your teen's symptoms might look like seizures, even though they don't have epilepsy, right? Or paralysis, tremors, or even chronic pain. All of these things are very real, and all of these things, nausea, vomiting, dizziness, ringing in the ear, all of these things are the signs of your child's brain is stuck in the survival mode. And why FND is often misunderstood is because it is a mystery, because here, FND does not show up on traditional medical tests like MRI or blood work. Some people assume that there's nothing wrong. And in essence, it is true, but then these are the stigma. If the doctor says, well, there's nothing wrong with you, everything looks fine, this is literally where the stigma starts. Because then teen, and then perhaps you guys as well, parents, feel invalidated and then confusing. Wait, what? This isn't normal, right? And some also, on top of that, professionals still think FND is purely psychological, and it's very outdated thinking, but they still believe that way, right? While stress and emotional things can play a role, FND is, again, biopsychosocial phenomena. So stress and anxiety trauma are not even required to get the diagnosis of FND. So if your doctor is still insisting and trying to dig in, what kind of trauma did you have? If the doctor keeps saying that, then the doctor is essentially the one who is giving the trauma, right, to the teen, right? But because of this stigma and then the history of what FND used to be called, there is still the old way of thinking about what FND is. I mean, come on. If your teen is faking these symptoms, oh my gosh, would they rather be doing something else, right? If the doctors are also thinking that they're doing this for attention, I'm pretty sure your teen is going to do something else to get that attention, right? So that's that. Again, FND is something that happens sort of like to them. It's not something that they're choosing to do, okay? But here's the good news. The good news is FND is something that your teen can recover from with the right approach. And it is not a life sentence. So if, again, the doctors are still saying that this is permanent, you're going to have to live with it. I mean, you could live with it, okay? If you want to, you could live with it. However, FND itself is not a life sentence. But if you are an adult who's got FND, the chances are you having the FND as a life sentence thing is pretty high. But teens, definitely lower. Okay, so there's a hope. So here's how to heal. The first step is you really need to know what you're dealing with. All right, so you have to understand FND. Learn as much as you can about the condition, and so you can advocate for your teen. And that doesn't mean that you have to take over, the care, because it's still happening to your teen's body. So your teen also needs to have a buy-in, which I have tons of videos about how you can get the buy-in from your team about this healing journey. But you also need to educate yourself. And this is not the time to do the Dr. Google where they can talk about mostly adult FND who's like basically saying, is this a permanent thing? This is like, part of who I am, that kind of thing. You can live like that for the rest of your life and then your teen's life. Trust me, I've seen that too. But you don't have to. That's the thing. Teen FND still has a chance, very high chance of resolving it completely. It's really time for you to understand what FND is. Therefore, that also includes changing or shifting your perspective. So instead of asking why this is happening, how can we work together to help my teen heal? And then taking a comprehensive approach is really the key, because it's not just about the brain. It is really about the whole person. Like I said, FND is a biopsychosocial approach. That's why the first line provider for treating teen FND starts with psychologists. Not because FND is a mental health problem, because a psychologist can deal with all biopsychosocial phenomenon. That's why. So treatment should include strategies for, again, regulating the nervous system, right? Because the brain is stuck on this survival mode. So we need to kind of get that out of the way, right? And then improving physical function. And this is where, depending on the conditions or symptoms of the FND, working with physical therapy, occupational therapy, speech therapists would be helpful. Not everyone requires to work with all of those people. So it really depends on the condition. And then addressing whatever else is going on, influencing factors based on biopsychosocial model. And the triple P, right? The three Ps, the predisposing, precipitating, and the perpetuating factors. Okay. And that's exactly why I created Teen FND Academy, to provide this step-by-step program that helps families work together as a team to resolve FND completely. So healing from FND isn't necessarily just about the team. It is really about the whole family. That's why parents' involvement is required for my program, because we need you to support the recovery. And when parents are involved, teens make progress much, much faster and more sustainably. So that this is going to be the thing to say goodbye to FND for good. And I am so convinced, because I have worked with so many families who felt stuck for weeks, months, and years sometimes. And once they started working together with the right tools, everything has changed. Now they're living their normal life and then thriving. And that's exactly what every parent wants for their child. Your teen does not have to live like this forever. So there is a hope. Absolutely. Okay. With the right approach, they can get better, and you can help them get there. And when you are ready to learn more and how you can work together to help your teen recover and resolve FND for good, click the link below and schedule a call to talk to me. Thank you so much for watching this video, and I will see you in the next video.